Cholangio Pancreatoscopy is a highly specialized technique that allows direct visualizations of ductal abnormality in the pancreatobiliary tree. The technique has been shown to provide important diagnostic information in the investigations of undetermined pancreatobiliary strictures, intraductal purpura mucinous neoplasm, and occult stone disease. Furthermore, the technique can guide endotherapies for treatment of difficult pancreatobiliary stones disease. SpyGlass direct visualization system is a recently developed single-operator cholangioscopy. This equipment consists of a 10-French disposable spy scope that have 4 channels for insertions of a 0.77 reusable optic spy probe, a channel for biopsy forceps or electro-hydraulic lithotripsy probe, and channels for water irrigations during procedure. There are, however, limitations to SpyGlass system, which mainly related to the large caliber of spy scope. Sphincterotomy is required for cannulations, and the spy scope is generally too large for pancreatoscopy, even when the pancreatic duct is dilated. The procedure is expensive, particularly when it's used only for diagnostic purposes, with the cost of disposable spy scope of $670 US. The use of tandem and deflecting-tip catheter can overcome some of these limitations, and we have successfully performed cholangio pancreatoscopy by using this catheter and spy probe. Tandem catheter is a 7 French double-lumen catheter that allows concurrent insertions of spy probe and water irrigations. The advantage of this catheter is its small caliber, flexible, and very low cost of $60 US. Similarly, deflecting-tip catheter has almost an identical structure as the tandem catheter, but also the ability to deflect in 2 directions gives it the advantage to steer through angulated ducts or difficult stricture. Our first case is about a 57-year-old gentleman with known colonic cancer and hepatic metastasis. He underwent both sigmoidectomy and right hepatectomy 5 years ago with adjuvant chemotherapy. He is now presented with jaundice and weight loss. Cholangiogram showed 2 round lesions in the left hepatic duct, which could be stone or polypoid tumors. Cholangioscopy was performed with combined tandem spy probe equipment and illustrated no sphincterotomy was required and the cannulations was easy. In addition, with smaller caliber, the catheter can be inserted high up into the hepatic ducts, which identify the filling defect as polypoid tumors. This allowed management plan to be formulated immediately, and a metal stent was placed for palliations. This technique is also useful for checking clearance of ductal stone after lithotripsy, as illustrated in this case of a 65-year-old woman with biliary obstruction by a large stone in mid-common bile duct. Cholangioscopy was performed after mechanical lithotripsy to check for ductal clearance. As shown, a large fragment remained impacted in the bile duct, and bleeding occurred as a result of ductal trauma from mechanical lithotripsy. This finding suggests that electrohydraulic lithotripsy under the guidance of direct cholangioscopic vision should be performed next to fragment the stone without causing further trauma to the duct. The last case involved a 56-year-old female with suspected main duct IPMN. Endoscopic ultrasound showed that she had a 3-centimeter mass lesions in the head with dilated and irregular main pancreatic duct. There was also cystic dilatations of side branches. Direct pancreatoscopy was successfully performed without the need of sphincterotomy. Ongoing mucinous debris and cystic dilatations of the side branches were clearly demonstrated by a spy probe. The subtle fish egg-like lesions could not be seen due to the low image resolution of spy probe. These lesions were clearly seen with electronic prototype of pancreatoscopy. In conclusion,
Cholangio Pancreatoscopy using the combined spy probe and tandem catheter is more advantageous than SpyGlass system by having a lower cost, less technically demand without a need for sphincterotomy, and is more likely to reach lesions in small ducts. This technique is therefore appeared to be more cost-effective for diagnostic evaluations of most pancreatobiliary disorder and should be further evaluated in larger trial.